Hello, friends, and welcome to my channel. I'm Jane from One Breasted Traveler. This is my Luca Grace, and we're very excited today because we have a special guest, another woman who has been diagnosed with breast cancer. And Dawn, hello, Dawn.
Hello.
Thank you for
Hi.
coming. Dawn is here to tell us her story and her experience and her feelings about being diagnosed with breast cancer. So welcome to the channel,
Why,
One
thank you.
Breasted Channel. Thank you, One Breasted Traveler. Thank you for coming. Now, Dawn, can you tell us a little bit about yourself and when were you diagnosed? About what, 6 months ago?
Uh, like 8 months.
8 months.
Yes.
Now, which means
It means it's number 0 cancer, and but it is cancer. Some people say it's a non-cancer, but Dr. Testa and the surgeon I went to said it's cancer.
it is a cancer. It is a cancer that requires treatment.
Yes.
Now, you had a special circumstance, right? So your mammogram, in your mammogram 6 months before your diagnosis, right?
Yes.
They saw calcifications,
Correct.
And calcifications are often a sign of DCIS. Not always. 85% of the time they're not, but 20% of the time they are about. They do represent early breast cancer, DCIS. But you got evaluated, correct? Can you
Yes.
tell us a little bit more about that?
I went to my regular place that I get my mammos, and so I went in and for the regular checkup, and they did the mammo, and then they called me back in and did a couple of more pictures, and so I thought, oh, maybe something's not right, and then they also did an ultrasound, so they did the ultrasound, and then they said, oh, everything looks good, we'll call you, and then I left. And then I got a notice that I have, what's it called? I can't remember the name. These
BIRADS.
Right.
They said that they were going to wait for 6 months, that for her to come back in 6 months.
Right, to come back and do it again.
So
go on.
So Dawn got the dreaded callback call, and they told her to come back to the center because we need more pictures. And they did take more pictures, which I assume they magnified those calcifications. And you magnify calcifications because they can characterize them a little bit better. Are they like meaner looking calcifications? Should we biopsy these? Are they benign round looking calcifications? Do we not need to? Can we just wait and watch these? And that has a range of interpretations. Some radiology, oh, Luca's saying goodbye, and which ones don't. And you're not always certain about that. There's nothing, as in life, certain, right?
Absolutely.
So they decided, and sometimes radiologists, myself included, struggle with this decision. Should we biopsy them now? Well, let's wait 6 months. And they call them, there's actually what we call a BIRADS, and it's a naming system of risk. And when you call a patient back in 6 months, you call it a BIRADS 3, meaning the risk is, I don't know, very low, like 98% that it's not, or 90%. Don't quote me on it, but something like that. Very, very approaching 100%, but never 100%, that these are okay. Right? So Dawn was a good patient. Some patients never go back, myself included. But, some patients never go back. But Dawn did go back. And then what happened?
Well, I went back, and then they said that, I should see somebody else. So I went to the Perlmutter Center in Manhattan, which is for breast cancer, right?
A very good center, part of
Yes.
NYU.
Yeah, and so they did more imaging. They did a MRI in my breast, and they did another ultrasound, and that's when they determined, or they thought that that was the correct diagnosis, and they recommended a biopsy.
Okay, so they used more tools, more imaging tools. They did an MRI, which can show calcification as an area of enhancement on your MRI, and they probably did more mammograms, maybe, right? Did they do more mammograms?
No, they just did the MRI and the ultrasound.
Oh, they didn't. So they didn't even repeat the mammogram and
No, she was pretty confident she
do
needed
enlarged,
to do,
magnified views of the calcifications. They didn't even do that. They didn't.
No, they did that at the first place. When they called me back, they had done that. They did more views.
6 months prior.
Right.
And so when she came back in 6 months for like another checkup, because that's what she was told, right? You were told from the first place.
Right, to come back
in 6 months. And at the follow-up 6 months visit, they usually repeat the mammogram and then again magnify the calcifications and determine what we always like to say, is there a change?
All right. Actually, they did do that first. You're right. I'm sorry. First, after they called me back to 6 months, they did that, and then I went to
So they must have said, okay, we gave her 6 months. They changed. They probably changed even a little bit, but we don't like that. There's a change in the mammogram. We don't like that. They were following these calcifications, which may or may not be benign, but they thought were benign. And, it's an educated guess because without a tissue diagnosis, there's no way to be certain. So they very appropriately said, let's work her up a little bit more. Let's give her an ultrasound. Let's get an MRI, and let's do a biopsy. So, it was a very fortunate thing, right?
Yes. Very much.
So were you upset about that? Because, in other words, they wasted 6 months. My reaction might have been, oh my God, that it is a cancer, and they waited 6 months, and I'm so mad.
Yes.
Did you?
Well, everyone always tells me, I have dense breasts, which means what?
It's actually the amount of parenchymal tissue versus fat in your breast. And dense breast means you have a lot of whiteness in your breast. And mammograms are white, and cancer is white. So you're looking for something white on white. And that's a lot more difficult.
It's harder to read, right?
It's a lot more difficult to read. Correct.
So I've always had a mammo and an ultrasound because of the dense breasts. So anyway, I was concerned, but not freaked out. I figured, okay, let's see. So I was like, okay about it. But you always have in the back of your head, what if? So... And luckily, I have Dr. Tester as a good friend, so a lot of phone calls. So I think that gives you a lot more comfort if you happen to be able to talk to a professional who you trust, obviously. And she knew about the cancer center because she had a similar experience, worse actually, but she went to Perlmutter too.
Yes, I did.
Yeah. So my gynecologist referred me to 2 physicians for the surgery. If I need it after the biopsy, and so I chose one of them, and she was great. So, but anyway, so I had the biopsy, and they said I have the cancer, and so they recommended. They asked me if I want to do radiation or not, basically, and if I want to take some medication. So I didn't want to do the radiation. And it was very low risk. It was like 5% that it would return. So I felt very good doing the biopsy. And so I did that. I didn't want to do anything further. They did recommend a medication. I tried the medication. I thought it gave me some joint pain. And I really didn't want to take a medication, that's going to make me feel bad. with just a little improvement in the chances of it not returning, like 2.5%. So I said no, and I feel good. I feel really good currently. And the biopsy was not a big deal at all. It wasn't painful. It was like, done really professionally. They had a nurse, they had a technician, they set me all up. Then the physician came in. She was great. She did the biopsy. I didn't feel a thing. I don't know if I was just lucky, but it was fine. And they were just so caring and good at their jobs that, different than if you go not to a breast place, or someone that doesn't just do that constantly. And plus, that place was just amazing anyway. And then the surgeon was fantastic. She was just great. You see her, and she makes you feel like okay about it. And she sent me a text message the night before my surgery and said, I just want you to know everything's going to be fine. You don't have to worry. I'm going to take good care of you. I never had a surgeon do such a thing.
That's impressive. Right. Wow, that's really even if it was might have been AI.
Right.
No, still
it made me feel wonderful.
It's a really
good thing.
Made you feel good. Well, it sounds like you got really good, expedient care, and sometimes that's the difference. And I agree with you. Sometimes you want to go to a breast center that does this every day, that is all plugged in, that has the resources around them, that have the staff around them, that can expedite your biopsy, because you had already waited 6 months. Yeah. So we don't want to delay it any further.
Yeah, and you want an answer. I mean, that for me, of course, like, okay, well, I have to do it, but you don't want to, I didn't want to wait 3 months to get the biopsy, more time after that. My sister also, she has inflammatory breast cancer, so I knew the routine, and also Jane and other people, unfortunately, that, over time.
Right.
So it was really important for me to have it go really fast. And they did that. They got everything set up. They did the biopsy in 2 weeks. They did the surgery, I think, 3 weeks later. So it was great. And I had I went back for my 3 or 4 month follow-up. So I had another MRI, not an MRI. They did an ultrasound and a mammo. And I'm clear for now. They always say for now. Right?
It's a very good ending, and I'm happy for you that you had a good experience, and that's the difference between a good center and a less experienced center or a less supported center. So I urge everyone, try to get plugged into a place. Like, you want to go to a place that does it every day, that is well supported by a university or by a hospital.
Yes.
And, where people are nice to you, where you can get an appointment, where you can get answers to your questions. So Dawn actually was one of the fortunate ones, because she had DCIS, which means even after 6 months of waiting, right? Which means contained in the duct. Right. Not life-threatening, not going anywhere else, and sometimes they want radiation to prevent local recurrence, but, and you did do radiation.
No, I didn't do the radiation.
You didn't do the radiation.
No, I chose not to. So you have choices to make, too. And, of course, I feel fine about it, but maybe in 2 years from now, if something shows up, I may think, oh, maybe I should have done this or done that. So, you have to take some responsibility and not just put it on them also, and be realistic, But I am one of the lucky ones. And I even said when I saw the surgeon for my follow-up, and I was like concerned because I stopped the medication, and she said, don't worry, if it returns, we'll fix you. And I thought, like, that was sort of sweet, like, we'll fix it. Don't worry about it. It's not a big problem.
You should have her text you that when you... Well, that's a great... I'm very happy for you. I'm glad that you had... overall, it was a pretty good experience.
Yeah, it was fast. It was because I had confidence, and because you gave me a lot of pointers. Really helps, You want to ease... get your questions answered. don't be afraid to ask questions. I know I get that way sometimes in front of doctors. You walk in and you have all these ideas. So I try to write a list, and I bring the list with me because I'm not going to remember.
Very smart.
Yeah.
Very smart.
And they never
That's
seem to
a good-
mind. They never seem to mind answering your questions because otherwise you're just running in your head.
That's great.
Yeah.
That's great.
Yeah. And so
That's good advice.
Mhm.
Yes.
But yeah, all in all, being you're facing possible bad diagnosis. It went smooth, and I am lucky. Even though you could take it two ways. Oh my goodness, I went through this, or it could be much worse, which is luckily how I'm looking at it.
Okay, well, this is why we make these videos, because we like to inform everyone out there that there is life after breast cancer.
Right.
And what do we want to tell everybody? Go get your mammograms. Thanks for watching One-Breasted Traveler. Please subscribe to my channel. If you like this video, please give us a thumbs up. And love you. Keep watching. Be safe. And please go get your mammograms.
Bye.
Bye.